So I think before we wanted to move on to the next slide, I think I just wanted to, Sume and I were thinking of just opening it up maybe to the chat box to see if any of these strategies were something that the folks on the line have used before. And I don't think we have a poll for this, but we just wanted to throw in the question.
Great, thank you for that, Samiya. So it's really, I think, extended some of the conversations we started having at the Learning Circle. So thanks for bringing your perspective to that. So Samiya's question for the group is, do any of these tactics, strategies, are they resonating? And if they are, which of them are resonating for you? So you can drop that in the comment box. We have 15 minutes left in the webinar, which we're going to open up to you, the participants, for any questions and comments. I see folks are dropping in some resources already. Thank you for sharing those. So any questions, so we'll look out for those. As we're waiting for questions to come in, this brings us back to the Learning Circle discussion. So typically we go in with these resources as similar to what we just discussed today, and we're often asking the group if this resonates with them and what is missing. So again, if you're thinking, if there's something which is jumping out at you as completely absent from our conversation, we'll love to hear that from you in the chat box. We also asked the group to reflect on how this was resonating for these specific projects. So we've been working with 2 organizations, Interior Health in DC, looking at data and surveillance related to the opioid use, and Ottawa Public Health is looking at client and community engagement. So really getting the reps from the various organizations to try and apply this to their work and to reflect as we're going through. It's been interesting for me taking part in being part of this project, even as NCCDH is going through some internal change of our own. So some of you may be familiar with our anti-racism work, and we started that in about 2016. So Samiya, when you spoke about disseminating information about progress and how that is a really important way in which organizations can create and maintain accountability outside of their own walls, I think it's something which we committed to doing. And as you were speaking, I wrote down, resist the urge to tell sanitized stories, because oftentimes as we're sharing the work of our progress, there's the tendency that could become more performative than authentic. So our team has had a lot of conversation about how do we maintain accountability, share what we're learning, and share that in a very honest and truthful way, as much as we can. So that jumped out to me as Samiya was speaking there.
Yeah, and I think if there is a real commitment to continuous improvement and learning from one's experiences and the idea of reflective practice, then there is definitely opportunities to, as we share these stories, that we're also critical about outlining and sharing our limitations and things that we haven't gotten to or we were not able to accomplish in the process.
All right, thank you. So I'm not seeing any questions coming yet, but I'm seeing some questions, comments. And so there's a comment in the box which says that health equity is just one of many changes which organizations are trying to implement. And so for many staff, this may seem like, they may see this as in the clouds versus underground. And that's really resonating with one of the conversations we had in the Learning Circle. So a lot of the people in the Learning Circle really spoke to the importance of this work being pragmatic and as much as possible trying to work within existing structures. So if there were groups which were already meeting around different issues, trying to bring in that your work into those spaces. One person in the Learning Circle shared just, I think they call them little huddles, to being able to just add a 15-minute conversation to something like, say, a staff meeting. So especially early in the process where you're trying to get buy-in, using existing channels as much as possible. Right, thank you. I'm seeing another comment in there, which I'm going to read out. So Monique is sharing that one sector I see this work happen in is in education. The schools have done a lot of work around equity, particularly around having difficult conversations to address racism, educating staff, involving students in education committees and arts-based projects. There's a strong message from the organization about the importance of equity, supported by an equity team hosting conferences for ongoing learning. Okay, so thanks for the example. I think that's a really good example which shows the integration of a number of the different elements we have been speaking to today. So please continue to share those examples. Samiya?
Yeah, great point, Steve. You have around, things that are more practical in terms of how we're doing this. So, for example, in Public Health Ontario, we have a health equity working group that is working with senior leadership to affect change in the organization. And one of the things that we just talked about is we have an internal SharePoint site that has monthly updates. So making sure that we have health equity actually has a permanent position or a permanent segment of that in the know, and so that we can continuously provide folks with what we're doing, what the change that we're trying to implement, as well as create space for people to share feedback with us as the change is happening.
Thank you. And seen another comment about health equity being seen as side of desk work in many workplaces, and that's coming from Diana. Thanks for that comment. And so I think I'm just reflecting on some of the conversations which this group has been having, and that's something which I would say has come up quite often. And on slide 30, one of the things that listed there is the importance of senior management buy-in and leadership. So a lot of the group has really spoken about how important it is for senior management to actually allocate resources to this work. And the resources can include some of what has been shared in terms of, say, particular teams dedicated to this work. But I think time is also a significant resource. So if organizations want staff to shift what they do and how they do, there has to be space for staff to actually learn, and that takes a bit of time, and then implement those changes. So I think we're seeing some good examples of that happening and the projects which we've seen through this initiative are really great examples. When we launched the call for organizations interested in being part of this, we had a really good response. So I think what that speaks to is that there are many organizations and teams who are willing to dedicate some of the time to actually learn and shift what they do, even though this may not be what most people in public health spend their time thinking about and doing. But I want to hope that there is a bit of a shift happening. Great. So thanks for those comments coming in. I thought we'd just highlight, because leadership came up so strongly in the conversation, some of you may have been maybe familiar with the work we're doing around public health leadership. If not, we will share those links in the chat box and in a follow-up email. So our new scientific director, actually, her PhD focused, Dr. Claire Becker, her PhD focused on public health leadership for health equity. And so a lot of what we were talking about on the Learning Circle was really resonating with some of what she found in her research. And so the models we talked about earlier talk about the importance of transformational leadership, and her work found that really supported health equity action. So that's the very first point on the attributes of the individual leadership. So were they someone who people trusted? Were they risk-taking and the like? We also pointed to the importance of the leaders having the knowledge to support health equity work, and also relationships, which again, I'm seeing some really strong resonance between the kinds of relationships leaders can build and the importance of building that process of change together. So I'll encourage you to, if you're interested in leadership, to explore that a little bit more. One of the things which we talked about with the public health organizations who are part of this work is how do we make space for innovation? So some of the comments which are being shared here is that health equity work for most organizations may not be part of the core of what they're doing. And at the same time, there are organizations who are beginning to dedicate or continuing to dedicate time and resources to support this. So we talked a little bit about the importance of making space for innovation. And this is a really a tool which you can use with your teams. It's called TRIS, and you can find it on the website of liberateinstructions.com. And so just think about what you're trying to accomplish. So think about the initiative you're working on. This exercise says, imagine what you can do to make sure you achieve the worst possible result. And it's a really good way to reflect on some of the things which we may be doing right now, which are not supporting our stated goals or our stated vision or our stated objectives. And then it helps you to start to, think about countermeasures to those activities. So I'd like to thank you all for joining us today. Samiya, before we wrap up, given the comments which have come through, any last points of reflection for our participants today?
No, I just beyond that, all of the frustrations that people have shared about, often health equity being something that we do out of the side of our desks, as well as not, often more quote unquote, in air quotations, more urgent items take precedent. I think that's something that's shared across the board, and it's about that idea of creating value and understanding that it's not, as I think Diane mentioned, it's not an add-on, it's an in. So build it in, not add it on. And all of this thing we're talking about, from communication to senior leadership buy-in to articulating our visions and our ideas very clearly, is part of that whole organizational changes and system changes that we're hoping to impact.
Great, thank you. So as always, the recording for today's webinar will be available online, and we are going to continue to share what we're learning through the Learning Circle with you. Our next webinar is going to be focusing specifically on organizational values for health equity, which is one of the really big themes which our group identified fairly early on. So look out for that. We will be hosting that in a couple of months. I also want to encourage you, so I know a lot of people share the kinds of challenges they're facing. And I think in today's webinar, it points to some really concrete things we can incorporate into our health equity change project. So as you reflect on those, I'm seeing some of the names on the line, and I can think about some really cool and interesting work you're involved in. So please go to Health Equity community to share those examples with us as well as other colleagues. And on that note, I'd like to thank you all for joining us today, and enjoy the